Welcome to today's session. Today we are talking about the things that you may not want to do in a consulting room. First thing is that you don't want to be making a phone call during a consultation process. Okay, that tends to cut the flow of your consultation, and that is also a bit disrespectful if you have to go through that. So you may want to turn your phone on silent or put it on flight mode. The second thing you may not want to do is to hold back information from your doctor or your medical personnel. Now that tends to do you more harm than good, especially when the information is relevant to your health condition. Now the third thing you may not want to do is to lie to your doctor. What do you gain from lying? So you don't want to do that, because if you lie, whatever information you give to your doctor, he's going to rely on that to treat you or to help you get better. The last thing you may not want to do is to obviously listen in on other people's consultation. So I'm talking about a typical consulting room in some of our Ghanaian hospitals where you have about 2 or 3 doctors consulting in the same room. Now you may not want to be turning your head to listen in, or obviously be looking at the other patient who is receiving a consultation. That tends to make them quite uncomfortable, and the whole essence of a consultation is lost on that aspect. So you may want to try and avoid some of these things anytime you find yourself in the consulting room. Now moving on to the things that we would appreciate if you do in the consulting room. The first thing is to smile. Smiling tends to lighten up the atmosphere, and it tends to give your doctor a sense of relaxation and a sense of comfort in managing your condition. The second thing you may want to do is to be asking questions about what exactly is wrong with you. Now, we tend to appreciate patients who are interested in the management of their own condition. So you may want to ask your doctor what exactly is wrong with you and what is his plan for you. He may not have one at the time, but he's going to be upfront with you and honest with you that he doesn't have a plan yet, but this is what he intends on doing, and that is also going to help you be responsible for your own management plan. Now, the third thing you may want to do in a consulting room is you want to be specific with your complaint. Now, that is when he asks you what exactly is wrong with you. You don't want to be beating around the bush. You don't want to be talking about a lot of events going on. That tends to bring some form of boredom. It tends to confuse your doctor and whoever is listening to you. You may want to be very specific with what is wrong with you, and then you move on to talk about what you want from the consultation. That will help your management get easier and a bit faster as well. So thank you for joining in today's session. Hope you learned something. Hi, I'm Dr. Nick, and this is Conversations with Dr. Nick. Follow the channels on your screen for more content and education, and together let's bridge the gap.